This video continues Chapter 24 of OEC 6, Abdominal and Pelvic Trauma, by really considering the major anatomical structures of these two particular cavities. When we consider the anatomy and physiology, remember this is the largest cavity in the human body. The abdominal cavity is separated in a superior position by the diaphragm, above which is the thoracic cavity. And then on the lower end, the inferior margin of the abdomen, is the pelvic brim, that kind of imaginary plane where we go across the top of the pelvic bones, the iliac crests. The pelvic cavity is encased by the pelvic bones, and consequently, those bones can protect some of those organs from trauma, which is unlike what we see in the softer abdominal cavity. Just behind the abdominal cavity are the kidneys and the abdominal aorta, and some of the organs in or just behind the abdominal cavity. We have these things that are involved with processing blood, kidneys, liver, and spleen. We oftentimes consider most of the abdominal cavity to just be digestive organs. When we look at the abdomen, remember during secondary assessment and a good head to toe, we divide the abdomen into 4 quadrants. A review of anatomy tells us that in the right upper quadrant, pain there could indicate the possibility of trauma to the liver. The left upper quadrant is critical because the solid organ, the spleen, lies there, and its job in acting as a repository for blood. Trauma to the midline might lead us to consider injury to the aorta or some of these digestive organs, the bowel or the pancreas, along with just those edges of the spleen or the liver. Review all elements of abdominal and pelvic anatomy by looking back at Chapter 6 if needed.